Another thing that we have used the class 4 for as well is anal furunculosis.
Yeah.
With really good, and anal fishes and things like that.
Yeah.
With tremendous success.
Yeah.
So the whole plethora of things I think that aren't really talked about as such.
Exactly. Well, it's one of those things as well. When I first sort of started using the laser, 3 years ago, that was one of, oh, you mean you can treat all of these conditions that we deal with? And that was sort of, surely, it won't cure everything. But actually, interesting that we haven't got the studies necessarily, other than, the anecdotal evidence in terms of anal furunculosis, but we do have they've done studies on interdigital cysts, which they also think there's a huge autoimmune component to
correlation with
dogs. And they showed less recurrence with those that were treated with laser than conventional treatment. So that was over, I think over a year. So the study. So it
and
was
lick granulomas as well.
Yeah.
It's amazing. Within a couple of weeks. Treating, I generally treat a granuloma 2 to 3 times a week, and within a couple of weeks the dog's leaving it alone. So
and do you often find that there is a physical, a suspected sort of physical injury, a tendonitis or a joint pain in that limb that is affected, or could it be pain from elsewhere?
I think it could be either or, couldn't it? Normally we see lick granulomas in older dogs, so rather than youngsters. So, but we see quite a lot of agility dogs, sporting dogs in practice here, and quite often we'll find that if they have had a soft tissue injury, or they've knocked a pole and they've had a wee bit of local inflammation in a joint, then they'll start obviously to lick that site, or if they can't get to that site, lick the carpal joint or whatever, as a soothing, or I'm assuming it's a soothing type of behaviour, and then it becomes a habit. So we quite often use it for those cases as well.